Hello. Today we'll be talking about 4 of the 5 epidemiological stages, and we will be covering stages 2 through 5 because no country today is in stage 1 of the epidemiological transition. Hello, my name is Idman, Loyan, and I will be discussing stage 2, which is the country of Niger. It is in sub-Saharan Africa, and it contains a high CBR and a declining CBR, as illustrated with the population pyramid, and it is growing at a rapid pace because of its low rates, and it is currently going through the medical revolution, and its population is estimated to be at around 23 to 24 million, and a projected possibility is the population reaching around 80 million by 2060 or 2070. Its population growth annually is 3.8, and it has one of the highest fertility rates in the world. It currently has around 40 hospitals. This is one of the main hospitals, the Niger General Hospital. But most of them are small clinics, and the current medical concerns are those with infectious diseases as seen as stage 2 countries, such as cholera, pneumonia, and typhoid fever. And nearly 70% of the population lacks proper health care, and not much is spent on it, with the annual GDP only spending around 7.3 on health care, and 89% of the public pays for it out of their own pockets. The amount of physicians is 0 to every 1,000 people, and it's one of the worst in the world. AIDS are actually not as prevalent in Niger, only 0.8 of adults carrying the virus, and the government's efforts to educate the population about it. The COVID-19 pandemic also did not affect Niger severely, with the total amount of cases being around 6,000. The theory that most pitched in Niger will be the Malthusian theory, which would be a significant lack of resources to sustain a population. Niger is undergoing massive population growth, so famine and shortages will be common during this time frame, along with poor conditions to sustain healthy food production.
Hi, I'm Nat, and today I will be talking about Stage 3 of the epidemiological transition in Mexico. The current population in Mexico is 127.6 million people. Mexico is currently in Stage 3 of both the demographic transition model and the epidemiological transition model. It is in both of these because of the rapidly declining crude birth rate and moderately declining crude death rate. And it also has a moderate national incidence rate. Due to the medical revolution, current main health concerns are chronic disorders from aging, cancer, and cardiovascular disease, which cannot be treated or prolonged with Stage 3 medical tech. The current leading causes of death are cardiovascular diseases, endocrine, nutritional and metabolic diseases, and malignant tumors. Approximately 50,000 cases of AIDS have been reported nationwide, and there are approximately 150,000 HIV-infected people living in Mexico. In the beginning of the AIDS epidemic, Mexico tackled it head-on. HIV testing became available to the public within the first year of it being announced. In 1983, the National Committee for AIDS Prevention was founded. In 2018, there were about 2.4 physicians per 1,000 people, and in 2015, there were 1.5 hospital beds per 1,000 people. Most people have moved from agricultural jobs to urban workplaces. The percentage of agricultural land is 54.9%, but over 80% of the population lives in urban areas. Mexico currently has universal health care. It is at no cost to the individual citizen. In 2019, Mexico spent about $1,150 per person in healthcare costs. The country and the epidemiological stage supports Bosco serious population growth because of the increasing intensity of shifting cultivation and Mexico's farming techniques being very efficient, grow more crops, and make more money due to the demand of the people for more food.
I'm Andrew, and I'll be talking about Stage 4 of the epidemiological transition in Australia. The current population of Australia exceeds 25.7 million people. Australia is currently in Stage 4 of the demographic transition model due to family planning, the change in social customs, improved medical support, advancements in technology, and the Industrial Revolution. The country of the epidemiological transition in Australia. The current population of Australia exceeds 25.7 million people. Australia is currently in Stage 4 of the demographic transition model due to family planning, the change in social customs, improved medical support, advancements in technology, and the Industrial Revolution. The country, like other Stage 4 countries, has a very low CBR, a low or slightly increasing CDR, and a zero or negative NIR. The top leading causes of death as of 2016 in Australia were first cardiovascular disease with 219.03 deaths per 100,000 people. Second, neoplasms with 201.65 deaths per 100,000 people. And third, neurological disorders with 76.18 deaths per 100,000 people. Other primary health concerns include heart disease, smoking, cancer, and COPD. Australia has maintained a low rate of HIV infection in comparison to the rest of the world. AIDS is no longer even considered an epidemic threat issue in Australia due to the successive treatments and extremely low HIV to AIDS progression rates. In 2016, there were 3.8 hospital beds per 1,000 people, and in 2017, there were 3.7 physicians per 1,000 people. The percentage of agricultural land is 46.66, and over 80% of Australia's population lives in cities. This country and epidemiological stage support the neo-Malthusian theory as the rapid growth of the population puts the country's resources at risk.
Hi, I'm Thomas. Today I'll be talking about stage 5 of the epidemiological transition. A very notable country that is currently in the stage is Japan. Currently, Japan has been seeing a decrease in CDR, while the CDR has been steadily increasing, causing the NAR to become negative. Due to this negative NAR, currently the population exceeds 125 million people, but is estimated to be under 60 million people by the year 2100. Another part of this is that the fertility rate is foreseen to not change much by 2100, further leading to the population decreasing. Currently, the largest health concerns are heart disease, cancer, cerebrovascular disease, and the most common cause of preventable diseases are from smoking, with 30% of the male population smoking and 8% of the female population smoking. Another common cause of death in Japan is suicide. Right now, there are approximately 30,000 deaths to suicide every year. Now, despite all of these underlying health issues, Japan has the world's highest life expectancy at 81 years for men and 87 years for women. A commonly speculated reason for this unusually high life expectancy is the diet of the people here. People commonly eat fish rather than red meat such as beef, and more commonly drink unsweetened drinks such as tea compared to other countries that drink things such as soda and juice. The country's epidemiological state and population supports the cornucopian theory as human ingenuity has suppressed the rapid growth of Japan's population during the late 1900s. One last thing is that the effect HIV has had on Japan. HIV has not been having as major of an effect on Japan as it has in other countries such as the United States, as Japan currently has 1,000 reported cases of HIV per year, compared to the United States' 36,000 cases per year.